It took nearly 3 years, but this week, the owner of a Texas med spa was charged with murder. And the medical director who lent her his license to make it happen, also arrested and charged with murder. I'm Dr. Kate D., founder and medical director of Glow MedSpa. And this is MedSpa Confidential, where we expose the risks, the red flags, and the outright illegal practices happening inside med spas right now, because you deserve to know the truth before you book. IV therapy is one of the fastest growing services at med spas nationwide. Most people don't realize when they walk into one of those places with pretty Instagram page and the $99 immunity drip special. Most states have no law written specifically for IV bars. Once you hear what was in that drip, who administered it, and where the supervising doctor was standing at the time, you'll never look at an IV bar the same way again. Courtney Walker is with me today, my favorite med spa attorney, to talk about this. I've been waiting for this to happen. So to recap, Jennifer Cleveland was a 47-year-old mom of 4 in Texas. She went to a med spa that was illegally operating in Wortham, Texas, and she died there. She got an IV performed by this woman, Amber Johnson. She had no license of any kind. She wasn't a nurse. She wasn't even an esthetician. She had 0 medical training. She did have a medical doctor who was her quote unquote medical director, who is an anesthesiologist about 106 miles away in Frisco, Texas. So the doctor basically had never saw a patient at this spa. This unlicensed person was operating on her own, didn't know what she was doing. And she hung an IV with basically lots of junk in it, including TPN electrolytes, which had way too much potassium, and it stopped her heart. And I believe anyone with any medical training would have known that, but this person did not. And they killed Jennifer Cleveland. And so this happened in July of 2023. So it's been almost 3 years now. And I've been waiting for this. I'm like, why have they not been charged with at least manslaughter, right? So I know you're a lawyer and not a criminal attorney, but like these 2 people conspired to make money, okay, at the risk of people's lives. And they killed people, or one person. I think it's a very strong case for manslaughter. I don't really know all the different levels of murder, though we've all watched TV and stuff. But what are your thoughts on this?
Yeah, I think it's inevitable, especially all the movement and outrage, rightfully so, around it. I mean, in the article that you sent over, you see her picture, and being a mom myself, I see it. And there's an entire community that's like, this person was wronged at the hands of exactly what you said. 2 people who were in it for money. One of them was not held to an ethical standard, but one of them absolutely was held to an ethical standard and is to protect her. And he absolutely failed. So I think it was inevitable, given the facts and the public outrage, that something was going to come of this. And a lot of times people think of, oh, I'll just lose my license. But more and more, it's like, no, you're going to lose your liberty as well.
Mm-hmm.
Yeah,
I mean, this man is going to jail. Okay, so I think they both are. And I think that rightly so. Now, as far as how long they're going to end up in jail, I don't know. But I think that it is absolutely unconscionable to practice medicine without a license. And it is absolutely even more outrageous that this doctor enabled Amber Johnson to do this at all. He's been to med school. He knows how hard it is, like how complex it is, how dangerous it is to be hanging in IV. I've said this ever since this happened. There's no quicker way to kill someone than hang an IV with the wrong thing in it. And there have been actually many cases of IV bar deaths. There have been ones where, someone thought it would be great to put turmeric in an IV. Boom, anaphylaxis, just like that. Like, this is no joke. I just got a message over Instagram about someone dying in an IV bar in New York City. That hasn't hit the news. I don't know any details, but I know that this is happening and it's super dangerous. And he absolutely should have known. And the idea that he was busy enabling this person to do this is just, it's so unconscionable. And the thing is that this is rampant in the industry. There are so many people practicing medicine without a license or using someone else's license. Essentially, it's, they're trying to dot an I that's not dottable. Basically, they get somebody's medical license on file, right? They pay them however much. I think the going rate for an absentee medical director is $500 a month, right? And they're renting out their medical license and they think they can do anything with that. And they're busy ordering IVs, they're ordering Botox, they're doing all kinds of stuff totally illegally. And I've been, on the record, this absolutely needs to stop. And what do you think is going to happen now? Because murder is a really big deal. Do you think that a lot of these absentee medical directors are going to put the brakes on that? What's going to happen, do you think?
I would like that to happen. And of course, you and I are in the same boat. Like, do we have to kill people for this to be like, oh, I actually need to pay attention to what I'm doing here? And it's not just in the IV world, it's prevalent in the hormone replacement therapy world. There was just a patient who had a heart attack. An anesthesiologist was medical director in Florida. As of right now, the license is all it's been deemed, but I think we're going to see more and more of this, that especially with the telehealth component of it, how just because you're providing telehealth services as the prescriber, whoever the prescriber is, just because you're there prescribing it, an intake questionnaire is not enough. Just going and signing off on all charts, not enough. Like, the patient's lives are in your hands. And I think we are going to see more of this. Another case in Florida, it was a lady dealing with telehealth, a prescriber signing off on orders, is currently in year 3, I believe, of a 75-year prison sentence. The pen, federal prison, and a mother of 5 children. But she made $1.2 million off of this scheme that she created with another company, and patients were harmed.
Wow. And this is a physician?
This in Florida, this specific one, a nurse practitioner.
Is a nurse practitioner.
That's so interesting. Florida has full practice authority.
Yes, but I thought that the law in Florida had been created so people could do primary care and not med spa. I think there was just a recent study.
Yes,
so she was a nurse practitioner prescribing in an area. Well, that's really interesting. I think that as we see more and more quote unquote wellness centers move into weight loss and hormones, I think we're going to see even more damage, because in general, with Botox, any damage you're going to do with real Botox anyway, or any of the other FDA approved toxins, that's reversible. That's going to go away over time. There's really not permanent harm unless you're using fake Botox, in which case you can have lots of permanent harm. But with hormones, IVs, other kinds of prescriptions, those can really kill people or do harm. Like, it's a way different thing. So people think of wellness as somehow safer or less dangerous, but it is not. So I think, so 75-year prison term, that's interesting. We'll see what happens to Amber Johnson and Michael Gallagher. I am so glad that this finally happened. I've been waiting for it. I really thought that it wasn't going to happen, because at the time in 2023, Michael Gallagher, the medical board in Texas, suspended his license for 3 months, but then they reinstated it with just the limitation that he couldn't supervise others, but he was still practicing as an anesthesiologist. And I thought, wow, that's all that's going to happen to him. So again, it's all charges that are pending. It's all alleged. We don't know what's going to happen to these people. But I think it's about time. So I'm actually really welcoming this, because I'm hoping this issues in a sea change in our industry, because the industry absolutely needs to change.
Yeah, I think from the patient perspective, you have said it, many times, of the value in knowing that you are seeing a provider, especially as we get more into wellness, because these things can actually cause you not to go home. Like Jennifer Cleveland, there was no world where she thought that was a possibility. And then on the provider side, from an attorney in this area, if true patient harm happens, we are not in a political climate in this industry right now where we're just looking at 3 months on license, 3 months suspended license. Because yes, in the hospital setting, patients die all the time. but you're still held to the same standard. Did you do what your duty, your ethical duty to that patient? Did you uphold that? And if the answer is no, then yeah, you're not charged with homicide in the hospital when a patient dies. But you have to hold that same ethical standard outside the hospital setting in a telehealth relationship. It's your job to look after the person who's under your care. And it's not just licensing.
Yeah. So for anyone listening or watching, absentee medical directors have been put on notice. Telehealth providers who really have nothing to do with that patient and really don't know them, they are on notice. And if you are using an absentee medical director or telehealth provider and you really are not licensed to practice medicine yourself, you're also on notice. So anybody who goes to a med spa, please make sure that all the people are licensed and they know what the heck they're doing, or your life will be at stake. There's no reliable way to know if a med spa is following safety standards or cutting corners. Until now, the MedSpa Board certifies clinics that prove they're doing things right, verified products, licensed staff, and actual medical oversight. It's the difference between rolling the dice with your health and knowing exactly who's holding the needle. If you're looking for aesthetic treatments, go to medspaboard.com to find certified med spas near you. And if you already have a med spa you love and they're not certified, please send them our link. If you're a med spa owner doing things right, get certified and show your patients you're not cutting corners. As a bonus, certified spas also save a ton on malpractice insurance. Do the right thing and go to medspaboard.com. Keep listening, keep asking questions, and stay safe out there.